Hey guys, April Lopez here coming to you from Lopez Family Clinic. Today's topic is nursing home or rehab. What is the best choice? So why am I bringing up this topic today? Because all of us are going to be faced with a hospitalization at some point in our lives. If it's not for us, it's going to be for our family members. And so what we want to be able to do is make a good, educated decision based on your family members or your own clinical status. What does that mean? Well, basically, you want to see where you're at as far as you're being able to walk or get your stuff done on your own before picking where to go. Now, I'm going to be very honest with you. We deal with this every day. And that's why I like to, before my patient goes into the hospital, already explain to them what the differences are. So there's a lot of nursing homes that have patients there that are long-term patients. Let me give you an example. You have your mother that's too frail and elderly to be alone anymore. There's nobody that can care for her 24 hours a day. So you need to place her in a nursing home. This is going to be a long-term nursing home. And this is going to be now your mother's new home, for example. Now, difference. You go to the hospital, in example, our patients that have, say they have a wound and they need some sort of in-depth debridement or they need some sort of procedure to help them heal. So we send them to the hospital, they get the procedure done. All of the specialists see them. So what happens next? That the patient needs some sort of rehab, right? At that point, it's very important to pick a place that can actually give you rehab. There's a lot of nursing homes out there that are selling themselves as a rehab, where in fact, they're not going to give you any rehab, okay? And so all of the videos that I'm gonna be uploading are gonna be to empower and to educate. It's also gonna be probably upsetting some people because they're not doing their job right, okay? So when you pick a rehab, okay, it could be a skilled nursing facility, but we need to make it very clear to the rehab that's gonna take the patient that you want rehabilitation. What that means is you're not going to be doing 15 to 20 minutes of physical therapy. You're going to be doing an hour of physical therapy minimum a day. I personally prefer inpatient rehabs if possible, because a patient can get 3 hours of therapy 6 days a week. And that would entail some physical therapy, lower body, occupational therapy, upper body, and it would also entail some speech therapy. A lot of patients, when they're hospitalized, lose their swallowing strength, okay? And this is another reason why a lot of patients end up with pneumonia, okay? And people don't catch it. So what do you want to do? You want to make sure that if you're in the hospital, you pick the right rehabilitation or the right post-hospital facility for your family. Now, you have a choice of where to go. I'm tired of hearing these people tell my patients, oh, the insurance didn't cover, and they haven't even ran the benefits. You need to make your case managers and the people in charge of your discharge planning responsible for ensuring that stuff is actually ran. Not that they're sending patients to their friends or to their colleagues or to their primas that is working in that facility. Okay? The patients always have a choice of where they go, and they have a choice of what physician is going to follow them in the nursing homes or in the rehabs. That's what we want to ask. That's what we want to tell you. Now, one more thing. You guys know I'm a wound healer. The reason we heal wounds here is because I need to look at my wounds every week. There seems to be something going on in the valley, and as you guys saw recently, I think there's a lot of stuff that goes wrong in the valley because people think that we're actually living 10 minutes south, but we're not. We're in the United States of America. Here, patients have rights, okay? Here, we actually have boards of nursing that we can get reported to if we're not being patient advocates. Here, we actually have Texas medical boards that we will be reported to if we're not being patient advocates. So be a patient advocate or expect to be reported. There is something going on in the valley where some skilled nursing facilities are telling patients that, oh, you have a follow-up appointment with your practitioner or with your specialist, but you don't have to go. We have people in here that can take care of whatever it is that you need. I'm sorry. If your patients have a specialist appointment, it is your duty, not only your legal duty, but your ethical and moral obligation to get that patient to their specialist's appointments. And you should not expect for the family to be paying out of pocket to go in there and get the patient in the car when they're supposed to be getting rehab at your facility. You guys should have transport and you should transport the patient to their doctors and practitioners' appointments. You should not try to discourage the patient from going to their follow-up appointments. Why? Because that's bad patient care. If you are in a facility or your family is in a facility and they're telling you, you don't need to go see your specialists, we have our own specialists here, guess what? That is poor continuation of care, and that is also solicitation. It is illegal to be soliciting for other practitioners, especially if those practitioners do not have good outcomes. Okay? Now let's talk about outcomes. The reason wounds heal is because they get debrided. They get debrided by sharp debridement. They don't just get debrided by a name brand medication that costs $300 and you're slapping that medication on the patient for 3 years. It is shameful for patients to be coming in here with wounds of 2 and 3 years, and the practitioners are slapping ointments that they probably do not even know what they're slapping on there, and they're clearly not healing. There is no improvement. So skilled nursing facilities, I'm calling you out. Family members, I'm empowering you. Patients, I'm empowering you to make a decision to go to the place that, one, is going to respect all of your follow-up appointments, and two, is not going to try to solicit for a practitioner that makes money off of having 30 patients on a roster that they will never heal. It is sinful, it is wrong, and I'm sick of it. We cannot look away in the face of what's wrong for patients, the frail, the elderly, the sick, and the poor. We cannot look away and say, everything's okay, and smirk about it. Not everything is okay. What's right is right, what's wrong is wrong. If you have good care with your primary care, you need to be taken to your primary care from any skilled nursing facility in the Valley. Okay? That is their responsibility. And they should not be soliciting for practitioners that work in-house. That is not their job. And if that is happening to you, report them to the state. Report them to the state and speak up for that poor patient that is getting an ointment slathered on them with a wound that is old that will never heal. So pick the right place, skilled nursing facilities, do a good job of giving physical therapy to these patients because you're getting paid for it. And do not try to solicit for practitioners that work within your facility because you want them to stay in-house so you do not pay the transport for these patients. Thank you.